The measures we've taken so far are working. In fact, in many parts of the country, the curve has flattened, but we're not out of the woods yet. We're in the middle of the most serious public health emergency Canada has ever seen, and if we lift measures too quickly, we might lose the progress we've made. So we all need to be very careful for ourselves and especially for the most vulnerable, like our parents, grandparents, and elders in long-term care facilities. Earlier this month, when we released the first modeling, I said that the path ahead was up to us. And the same holds true today. How many new cases there are, how many losses we have to mourn, whether our hospitals can continue to cope. It's all up to all of us. You've already stepped up to help your family, friends, neighbors, and frontline care workers stay safe. And your governments across the country are stepping up as well. We're a big country and we don't always agree on everything. But right now, the premiers and the federal government are working together to fight this crisis. We need common guidelines to make sure that the decisions being taken across the country are grounded in a shared understanding and appreciation of what science and experts are telling us. Shortly, we'll be releasing the shared principles on restarting the economy agreed to by the federal, provincial, and territorial governments. Let me be clear. These are not the specific measures when you can go back to work or school or when you can see your neighbors or extended family or friends. This framework will lay out the things that need to happen before we take any next steps. Restarting our economy will be gradual and careful and will be guided by science. Here's what the guidelines mean for you. Controlling transmission is key. You already know that if your neighborhood doesn't have new cases, if your province is flattening the curve, this is a good sign for being able to slowly look at lifting some restrictions. So we need to know where things stand. To reopen the economy, there must be enough capacity to test and trace COVID-19 to control any new spread. For you, that means knowing that you'll be safe at work when you go back. You'll see lots more testing, and if someone around you does test positive, you'll be notified quickly so you can isolate. At work, there will also need to be specific measures and more equipment to keep you safe. And for hospitals, we need to make sure they can continue to cope not just for COVID-19 patients, but for everyone who needs care. And for certain groups who are very vulnerable, like seniors and those in long-term care facilities, strong measures will have to be in place for longer. This virus is taking a different toll on different people. We must be mindful of that. Whether you're facing domestic violence or living in a remote community or a long-term care facility, we're working on the front lines. We're here for you. Our priority is keeping all Canadians safe while getting back to normal as much as we can.